Hi, I'm Luna Okada. I was diagnosed in December of 2012 at the age of 54 with stage 4 adenocarcinoma of the lung. I had a small lung tumor, but my liver was loaded and it had seeded many of my bones. My husband and I have been married for 38 years, and we share two adult children, Nathan and Nina, and we have two grandsons, Nori and Kai. They're 2 years and 4 months old. I am a retired genetic counselor. I retired last year after 41 years of genetic counseling. Um, and I have been really grateful because I have such an incredible village of both family and friends who have supported me, not only with my cancer diagnosis, but pretty much throughout my life. I have a little bit of an unusual history for my diagnosis. I've never had lung symptoms. So the week before I was diagnosed, my family and I were on this incredible trip to climb to Machu Picchu. And so I had been training because I was going to be the limited factor in my family for holding us back, and I didn't want to be the limiting. So my point is that at the time that we went on this trip, I was probably the fittest I'd been in 20 years. We came back from that trip, and 2 days after we came back, I had incredible abdominal pain, and I was certain that I had some infection from drinking bad water in South America. Um, but it was significant enough, and my husband's a pediatrician, that he decided that I needed to be seen in an ER. And from there, we did imaging, and I was found to have advanced cancer. We didn't know where the origin was at the time, but there was a small tumor in my lung. My liver was loaded, and most of my bones had tumors in them as well. But I really had no symptoms. I had some achiness when I was training, but I thought that was because I was in my 50s, and I wrote it off to just being an older, active person. So no coughing, no short of breath, nothing. I was laying there, and my husband was with me, and it was getting later at night, and it took a long time for the ER doctor to come back to tell me. Um, and what I later learned from some friends of ours a friend of ours who works in the ER, but that was that this physician was looking at my imaging, knowing that I had these tumors all over my body. He was having trouble coming in to tell me. Um, and he told me, he used the words, "We found a lesion in your lung, liver, and bones. And we'd like to admit you so we could figure out where the origin of these tumors are." And I was listening, and finally I was like, "Time out. Are you telling me that I have cancer?" And he said, "Yes." Because all the words that he never said the word because he was having trouble. Um, but so I had to just clarify for him, "Are you telling me I have cancer?" Um, and I was stunned. I had always been such a healthy person. Um, and again, we didn't know where the origin was at the time. So I was admitted for a couple of days, and had lots of blood tests and more imaging. And they told me that they thought I had lung cancer. And I actually couldn't believe it because I was such a low risk person for lung cancer. I had no risk factors. Um, so and back then I was ignorant enough to not realize that people who never smoked could even get lung cancer. I didn't know enough about cancer. I didn't know the stages of cancer. So I was kind of in that place of ignorant bliss kind of thing. I didn't really know. And we were sitting with our friend, who is a surgeon, um, and um, Win was my husband was crying, and I was so sad, and I said, "Win, don't cry. I maybe this isn't a big deal." And our friend, the surgeon, said, "It's a big deal." And it was um, it was really good for me to hear, because here I was in this la la land thinking I could, I'll get over this. This will go away. But he said, this is a big deal. And that was the first I got that pit in my stomach. Um, and I'm not upset. I mean, I actually was sort of grateful that he put it on the line like that for me. I'm very much a practical person, so you don't have to talk to me with a lot of fluff, or I don't really want to be reading between the lines. I just want you to tell me what's happening. So it was it was okay. I think I cried because I was making everybody so sad. Um, but it wasn't, and also I think it's somewhat cultural. I mean, my family's Japanese, so we're sort of, okay, what's the next step? And with the realization that, there's a circle of life. And so, it's this all will happen. So I've always had this more practical approach to it, my diagnosis. The next steps were to do a biopsy, because at the time in 2012 and early 2013, they had just started testing for biomarkers, for tumor markers, because at the time there were only two, now there's many more, but there were two uh, gene mutations that were treatable with an oral chemotherapy. And one of them was a gene called EGFR. The other one was ALK, or ALK. So we did a liver biopsy. Um, and I was really hoping for one of those, because the thought of having to just take a pill a couple of times a day was really appealing to me. But I came back negative for those. And so um, it got to be, so that was mid-December. It got to be towards the end of December, like 2 or 3 weeks later. And we had done all this testing, but we really hadn't done anything to fight the cancer. And I was getting anxious that it was continuing to grow, and I really wanted to get something going. But so when we got the negative biomarker tests back, I started a traditional chemotherapy. And I was on a 3 medication chemotherapy. I was stunned by the cost of them. One of the medications they wanted to give me, so I was on carboplatin, Alimta, and Avastin, and my insurance had not approved Avastin by the time they get me into the chemo room. And so I was given the choice that they could give me the Avastin, but I would have to put the cost on my credit card. If my insurance approved it and the practice received payment, I would be reimbursed. And it was $7,800 for one dose. So I, of course, said, well, why don't I just wait? I'll come back and get that third dose when our insurance approves it. And my husband said, no, 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 we're just going to put it on the credit card. And I said, no, no, no. So we had this, because in my head, if I was going to be dead in, 6 to 12 months, I was not leaving any debt. That's where I was coming from. So I told my husband, I said, no, no, I'm going to wait. I'm going to wait. So we had this hissing disagreement in the chemotherapy room, where he was saying please and I was saying no. And eventually, and I tell this story because it's so him, so me. He said, okay, why don't we put it on our Costco American Express card, and we'll get cash back. And I'm like, okay, we'll do that. So that's what we did. And we got reimbursed and everything was fine. I had 2 rounds of that. And I had all the classic side effects. And then when we did follow-up imaging, I had disease progression. So it wasn't helping me at all. And that's when my doctor suggested that I get tested for this newly described gene mutation called in ROS1. And it was new. It accounted at the time for, they thought, between about 1% of people with adenocarcinoma of the lung. And in my head, because I do work with a lot of statistics in my business, I thought, okay, that means 99% chance I'm not going to have this. And when I checked with my insurance to get the pre-authorization, I was declined because I had already had gene testing with this negative ALK and EGFR. So, and it was going to be, I don't remember how much it was, but it was going to be thousands for us out of pocket. And so I'm like, I think I'm good. I think I'm good because, again, I'm not leaving debt. And my husband and my oncologist talked me into it because they said, if you have it, there's a oral chemotherapy for it. The good news is that I was able to get this liver or this biopsy. They sent it out. I was positive for ROS1. And as soon as we wrangled with our insurance company, but as soon as we got that, I started this medication called crizotinib. And I've been on it for almost 12 years now, and it's controlled my cancer. Um, so it was a harrowing story. There's a story mixed in there with a lab error as well. Um, and but when it got all straightened out, I was positive, and I've responded really well to this medication, and I'm amongst a handful of people that are getting really long duration on this oral chemotherapy. I mentioned a lab error. So initially, what happened was the lab report came back saying that it was positive, that I had it. And that's when we started scrambling. And then my doctor had actually split the sample and sent it to another laboratory. And the second laboratory came back and said I didn't have it. And so here I was taking a medication that was $15,000 a month. And I was thinking, oh my God, we're treating the wrong thing at $15,000 a month. So, and that's when I read all my records. We found out where this biomarker was tested. My oncologist, who I'm so respectful of, called the laboratory director who reran it and said, and published a report saying that I was positive. There was a lab error. So then once I got that reassurance from two separate labs that I had this mutation, I felt very confident that I was on it. The good news for me was that once I started taking this oral chemotherapy, I had tumor shrinkage. I had all my other biomarker testings went down to within normal limits within a few weeks. And there are some side effects that I have to manage, but I'm alive. And I've been stable for going on 12 years. So I've been really lucky. So bad disease, good medicine, and a lot of luck. That's what it is. I think in the last several years, every oncologist worth his or her weight in gold is doing biomarker testing. When I was first diagnosed, there were some oncologists who were hesitant about it because they were going to wait to see if it panned out. And I get that because there were a lot of testing things that didn't pan out in cancer. But this one was real. And at that time, when I was talking to people, I'd say, get a young oncologist, get someone who had training in their fellowship with genetics. But now I don't really feel like I need to say that because most all oncologists will test for it. My other recommendation for cancer patients is, so my goal at the time when I started living longer than my expiration date was I wanted to be the healthiest looking, sickest person I know. So my plan was to eat right, sleep right, and exercise every day. And what happened for me when I got this new attitude about it is that I became very, it was almost like a transformation. I really felt much more positive about life, that I wasn't going to die of cancer, and that, maybe I should get mammograms and maybe I should restart my statin because I could really die of something else. So I'm not, so that so much of it is an attitude of gratefulness. And I feel gratitude every single day. Um, and that feeling keeps me going for tomorrow. Um, so it really is about an attitude and a positive way of looking at toward the future. I kept thinking in my head, my mantra was, I just need a little more time. And the reason I felt um, so needy of more time was that my kids were just being launched. They were in their early 20s. And I felt like, they were adults, but I just needed to let them know a few more things before I could check out and know that they were going to be okay. Um, so I did whatever I could to just get a little bit more time. Um, and and hope was wrapped up in all of that. But I became very type A about my medications and my vitamins and exercise, and I really worked toward that mind, body, spirit triad and the balance of that. Um, and that was really that balance, or that need for balance, was my hope for my future. When I'm by myself, um, other than making sure I take my medications at the right time of the day, and I'm pretty type A about that, I don't really think about being a cancer patient. Um, there's a lot of organizational things, like I have to schedule CT scans and MRIs and make sure my insurance. So that eats up, a fair amount of my week. But um, do I identify? I guess I do identify as a cancer patient, because when someone tells me they have cancer, and then if they tell me they have lung cancer, for me, it's an automatic connection. And as much as I want to get to know them, I want to know their story as well. Um, so I guess when I think about it, I do identify as being a cancer patient, and specifically a lung cancer patient. And when someone tells me that they're a ROS1 lung cancer patient, they get a hug. um, and in August, the largest group, because we're a small group, only 1% of 1 to 2% of individuals with lung cancer have a ROS1 mutation. The ROS Wonders met in Colorado, and there were probably about 50 of us. And we shared stories, we shared information, we shared contact information so we can be in contact with each other. There are a lot of people that have asked me, do you ever wonder why you? And I guess I take that and flip that a little bit. And I always wonder, why not me? These are, I feel, I'm human, I'm vulnerable to disease. And again, I'm a very practical person. And I've always been a realist in terms of everybody dies of something. so um, I never took it personally, and it's better for me too, because I think there's so much stigma surrounding smokers, um, and so, but as far as I'm concerned, even if I did smoke, I don't deserve lung cancer, and so. Uh, I feel badly for people, and certainly I've asked, I've had nurses ask me when they're taking care of me, did you smoke? And my response is, no, why do you ask? And so, because that just, and then I try to educate them, that roughly 40% of us are never smokers. And, really the only risk factor I have for having lung cancer is that I have lungs. So it just, I don't know why I have it. There's an uptick in Asian women who have lung cancer. And it's probably has to do something with our pollution and that kind of thing. But there's not one thing that I can put my finger on. So why not me? Lung cancer can happen to anybody. And uh, so I'm very supportive of screening programs. I think the screening criteria is very narrow now. You have to have so many pack years of cigarette smoking, and you have to be over 50. But I think that if you're concerned, if you have a family history, or if you do qualify for screening, have it done, because it's a very treatable condition in its early stages. So don't get on that boat down the Nile. Don't do the denial thing. Just head on, be brave and strong, and seek medical care.